Hi, this is Laurel from the Seagull Nest. Today I'm talking to Dr. Cami Cleveland.
Hi, I'm Cami. Nice to meet everyone. And great to
Hi,
chat with
Cami.
you, Laurel.
Yeah, thanks for coming.
Yes.
So I'm just gonna hop on in. Can you tell me who you are and what you do?
Yeah. So I'm a chiropractor. I currently practice in Newton. I originally practiced near New Haven, Connecticut, and made my way up here to be closer to family. Populations I like to treat, love treating pediatrics and pregnancy, and then athletes has been like my other big niche as I go through this, journey of work.
That's really cool. Do you have a preference as far as athletes, like specific type of athlete? Do you like seeing postpartum or not postpartum, pregnant athletes?
Yes. Yeah. So I actually just got certified in what's called Birth Fit. So it's for the pregnancy athlete or any pregnant person. But I have a connection with the CrossFit City Line right down the road. So I see a lot of CrossFitters, which is so fun. It's like such a hardworking population. And I really enjoy working with them because they have really high goals for themselves, like really high aspirations outside of like their occupations, which is so fun to see like as an adult.
Wow.
Yeah.
I can't imagine doing CrossFit not pregnant. So
yeah. Yeah. It's really fun to watch. There's a lot of modifications, and that's what Birth Fit taught me, is like how to modify and like safely work out, which is super important and not talked about a ton.
it really isn't. I clearly don't work out, and I'm not pregnant also, but a lot of people treat pregnancy like an illness or a disease.
Yes.
And
Mhm.
it's nice to hear a medical professional say like, it's not.
It's
Like,
not at all. It's an amazing, it's just a part of some people. It's a part of some people's lives. I do know for sure it is treated like an illness, which is really sad. And it's also treated like some terrible conditions like low back pain is like just normalized, and pain is okay in pregnancy, and like reflux is okay. And it's none of those are really okay ever. And I don't know why in pregnancy they get like the yellow card, like it's free, pass on, like it's fine. So
a lot of things are just okay in pregnancy or not, and
yeah,
it's really interesting.
it is awesome. Um,
um can you tell me what a chiropractor is for people that don't have a clue?
yes. So like at the base of the chiropractor title, it's like an expert of the musculoskeletal system. And like digging a little bit deeper into that, what we do is we work with finding mobility and restriction of the spine. And typically that will lead us to like the nervous systems, like what's not functioning properly. Our whole job is connecting the brain to the rest of the body. That may look like, it may look like acid reflux. It may look like sleeping problems, or it may look like uh, allergy symptoms. So like we can help with like fluid movement and things like that. It's not always musculoskeletal that we can help with. And that's where the pediatric realm comes into play. So it's a really broad umbrella. For athletes, musculoskeletal care. For pediatrics, it can be reflux, constipation, diarrhea, colic. For teenagers, it can be for like ADHD. It can be for asthma. If your nervous system isn't functioning properly, it's what controls everything. So
That's really
important.
amazing.
Yeah.
I mean, admittedly, I don't know a ton about chiropractics. I just know what I know. But basically that you treat the back and the spine. And I know there's a lot more to it.
Yeah.
So it's so interesting.
Yeah, the same nerves that feed the muscles feed the organs. So
right.
It's all connected.
Are you able, I know I want to talk more about pregnancy and stuff, but for right now, I'm curious. Can you go into detail about treating a newborn, an infant, a toddler, a child, and like a teenager, and like what that looks like and how it impacts them just in general?
Yeah, so we normally for newborns, we classify birth as like the most traumatic event of a small child's life.
Right.
And a lot of times birth has to do with like either pulling a limb, So it can not knock things out of place, because at that point they're pretty spongy, but the nervous system is still intact.
Right.
So with chiropractic and pediatrics, it is super like neurological and super gentle. So we start from the base up always. So for the base of a little pediatric spine or newborn spine, you would just start with balancing the pelvis, making sure the legs and hips are freely moving. If you think about it, if you have restriction in the lumbar spine or pelvis, how do you expect digestion to go? It's probably not going to be too great. For them, you can really see more like standard symptoms through physical like manifestation. So in the neck, if they have something not moving appropriately, it's a really small contact hold. That's all they need. It's just a little stimulus to one little specific area, and that could help them digest better and have less reflux and less colic. Colic is not necessarily a pain response, because I don't think babies are feeling pain, but they know when something's not moving appropriately or feels right. As far as like working your way up through toddler, through entering school age, their adjustments do look a little different, because then we start manifesting stress. So now we see different stress responses. Maybe we see aggression in our child. Maybe we see pulled back from the class, or small little cues that like somehow they're carrying this stress. So again, it's a super gentle adjustment. I'd say until about 12 or so, then we start getting more of like the popping, the standard chiropractic adjustment. But until then, it's really about balancing the nervous system. So there's a lot of schools of thought that you can adjust for certain areas. So the neck and the low back are your poop and your croup. Your neck and low back are responsible for calming, and your mid back is for hyper, so if fight or fright.
Yeah, right.
There's some chiropractors that only for kids will be like, okay, just based on what we see with your kid presenting today, maybe they're having a high stress, like they're bursting out of school. Maybe don't adjust the mid back. Maybe give them a little parasympathetic stimulation.
That's so interesting.
Yeah, and you might see a change in that child's behavior just because of that change of neurological response. And
wow.
Yeah. There's a lot that goes through my head when we think about that, because it's not only physical, but it's mental, it's emotional. There's a lot that can change with your nervous system.
There's 4 children right off the top of my head that I am thinking of that could use help with all of those things. So, I mean, I work with lots and lots of kids, but it's just the way you were mentioning that. It doesn't always have to be a chemical solution. It could just be it's a physical solution. And when they feel good too, after getting adjusted, they feel really good. Yeah. When you feel good too, you have less of that, like, I don't know, high-low behavior. That's so interesting. Can you talk a little about the stigma around chiropractics? Because I know a lot of people consider it to be like woo, but not. If there's a science, it's a science.
It is. It's a science. And I always joke when someone says like, I believe in it. I'm like, well, it's not really a belief system, really. It does work. I think we get a bad stigma because there's a very wide range that we practice. So I think you really have to do research on what you want to get out of your chiropractic experience. There are chiropractors that use like a lot of sensory with their adjustment, like essential oils, or a lot of like stim, or just other like modalities and things like that. So there's a chiropractor for everybody. If I want more of like a neurological tonal adjustment, it's very soft, like it's slow movement, it's really light. But if I want like a more popping, cracking adjustment, which is what I like personally, I would try to find a chiro more in line with that. So I think.
And where do you stand?
Where do I stand? Oof. I really enjoy more of a physical approach to my adjustments, but I have a deep appreciation for someone that is like, hey, smell this oil after you get adjusted, because the scent body memory could help. I'm not going to say no. I'm like, okay, I agree, because there are studies that show if you study with lavender and you bring lavender to a test with you, your recollection of what you did with lavender like grandma's house, chocolate chip cookies or apple pie. Like you have these scent associations. So if you associate a scent with how you feel in that present moment, you may be able to recreate that experience.
That's really interesting.
Yeah.
I am a very sensory defensive person, and like a lot of smells are like really bothersome to me, and touch in general is very bothersome to me. So thinking about it from that perspective is just so interesting. And I wonder how
differently.
How do you tend to treat folks that are sensory defensive or sensory seeking?
Yeah, so that is not a popping appointment. That is more of like maybe vibration or like a tool assisted adjustment. Something that is going to stimulate the nervous system, but at not as a drastic rate as a physical adjustment. That's where the chiropractor has to know their audience. You have to be willing to have that conversation with your patient. Like, what do you expect from this? And what do you feel comfortable with? A good chiropractor will totally change an appointment for someone that has something sensory. Like I have a few fibro patients right now. Their adjustments are slow. They are gentle. The lights are off. It is low sensory. Autism as well. Low sensory environment. I don't have the diffuser going. I don't have the lights on.
Yeah, like, you don't want to overstimulate.
Oh my gosh, absolutely not. You don't want to put anyone in any sort of fight, fright, or stress state. Like they're here to not be in a stress state. So it's a lot of accommodating, but I think the school that I went to, you have to do 5 techniques. At least you have to be proficient in 5. So you should somewhere in your arsenal have all the tools you need to treat any sort of person that comes through your office.
Wow. So I know you've seen my wife, Heather, who is pregnant, and she mentioned that you were getting certified, I believe, in the Webster technique.
Yes, I've been certified since I got out of school.
Oh, okay. I thought she said you were doing it, but yay. Can you explain what that is? Because I know it has to do with pregnancy and postpartum and all the things.
It's all pregnancy and postpartum, truly. So the Webster technique is something, if you are pregnant, look for a chiropractor that's certified, not that just does it on occasion. You want someone that took the course and has certification in it. It is all about how the pelvis is dispersing the pressure from the baby and how it affects the pelvis. So it's bone, muscle, ligament. So there's 3 contacts in the front and 3 contacts in the back that are bone, muscle, ligament, that if you help release them or balance them, baby can move more freely. Mom typically has much less back pain. And it speeds up labor time. I think your first pregnancy is by 32% and your second one's 46%. And there's actually a practice in the South Shore that is starting to mark off if the patient has chiropractic care throughout their pregnancy to track labor times. Yeah.
That's really cool.
Yeah.
I know for anyone watching this, Heather is in a lot of discomfort. I hope she doesn't hear that I'm sharing that. But like she's in a lot of back pain. She's lower back pain and she's getting a lot of pressure in her pelvis.
Yeah.
And I almost wonder, I mean, at this point, she already has all the appointments with all the people. So, but I almost wonder if chiropractic would have helped her to feel better now versus earlier in her pregnancy.
Yeah. So the reason why she's feeling pain is because your brain is constantly trying to stabilize your pelvis, but in pregnancy, it's constantly trying to expand. So it's like your brain fighting what your body is doing, and it's extremely painful. Your ligaments, they are designed to stretch, but stretch and load are challenging for any pelvis. As far as pregnancy goes, typically care-wise, Webster protocol says that you're supposed to do once a week, first try 2 times a week, second try 3, third try. I'm not super hard knock on that because I feel like every pregnancy presents different issues at different times. If you're doing really well, I don't really need to see you too much. It's good to check in once in a while. But toward end of pregnancy, it wouldn't be unheard of if I've seen someone 4 times that week just for pain.
Yeah. I mean, pregnancy is so painful. And
it can be, it shouldn't be. It can be though. Towards your end, I don't think it's avoidable, but
yeah.
yeah. The goal's always less pain.
What was that?
The goal's always less pain.
Yeah.
More function, so you can have like a more peaceful delivery.
Right. Does chiropractic treatment hurt, and is it dangerous?
Danger? No. I think we get this bad rep for like artery events or cardio events. That has been debunked so many times.
Oh, good. Okay.
The likelihood of any sort of like stroke or possibly like that is like being struck by lightning twice in the same day. So it's like 1 in like over 2 million. So safety wise, super safe.
Okay, good.
If you had a prior cardiovascular event or an extreme car accident or something that might have caused some sort of like arterial dissection, that is something that you would inform your chiro in the history. If you don't, tell your chiropractor, because they might approach the care a little differently, because safety is first. Right. As far as hurting, no, it feels like a pressure. If you ever like popped your knuckles, like that buildup of pressure is like uncomfortable, but when it releases, it's like, feels good. That's standard. That's pretty much the only time people have pain is if they, normally when they come in with pain, sometimes it's just inflammation in the area. Nothing that I press or like twist or do should be painful. It should be a pretty just relaxing experience.
That's fair. I know a lot of people, I mean, chiropractics has a bad rep.
Yeah.
And that's why I was really excited to talk to you. And I'm glad that we finally connected, because I think it's really important that people understand why body work is so important.
It's so important. It's all you have. It's your
right. And so we're about to have a baby. Everyone who's ever watching this knows that. And our son will be visiting you as soon as he's born.
Love that.
So what are I know you mentioned it a little, but what are the benefits of getting a newborn adjusted early versus later, if there are any differences? And how could it impact anything long term? Are we going to have to keep going back?
Yeah. So the benefit of getting checked early is that movement patterns develop as soon as you leave the womb. So if you were pulled to a certain degree, you may have lack of rotation on one side. That's definitely something we check. Is like, how well does the head move? Other things that we check aside from skeletal, we do a lot of cranial work too. So there's a lot of like suture massaging. There's a lot of organ massaging, just to like, and I show moms do this too. So it's like, I'll show you like 3 easy checks to do at home. Like squeeze the butt cheeks together. If you see that the butt cheek or the gluteal line is like off curve to one side, something's off in the pelvis, and you can see it that it's off. If that sacrum's rocked a strange way, maybe that's affecting maybe that's causing more diarrhea or more discomfort. You can also tell really easily if there's tissue restriction in infants. So just by scanning to see if the tissue is moving symmetrically, especially in the stomach area, that could also improve digestion, which also leads to like less discomfort. A lot of infant discomfort is from digestion. And it could be from neck as well, just because they normally sleep with their neck crooked one way. Right. But until we get into like more tummy time phases, we don't really notice these restrictions too much, because tummy time is when we start developing our curvatures. So infancy is mainly colic, ear infection, digestion, and sometimes moms really want the hips checked, because hips are super important. Your pediatric definitely is doing hip checks for any sort of malformations or things like that. When we start developing curves, sometimes we don't get enough time developing the curve. So it's always good just to have someone remind you like, hey, more tummy time, or hey, they're not reaching that marker yet, or hey, they're reaching with one hand, but not the other hand, or they're only recruiting with the right leg to start crawling, not the left leg. So sometimes I won't see kids right after birth, or sometimes I will. It'll be to a point. Normally I would do 2 checks to see how the one check as initial, 2 checks to see how the first appointment went, and then gauge. Normal after 2, you can kind of see like, oh, he slept so much better, or we had way less reflux. And then it's more of like a conversation. It's not like you must come back. It's like, let's try it. Let's see in 2 weeks, or let's see how he does for the month. Infancy care is much more spread out because they're super adaptable. They adapt so quickly to what you input, and they don't have stress, so they don't have the whole added factor. But when they start crawling and stuff, it's really, that's when people normally start bringing their kids in, is when they start moving around, because they'll start noticing like he can't sit crisscross, or like he's always like when he crawls, it's always he rolls to this side only, or when he turns his head, he won't turn his head fully the other direction. So moms really start picking up, not dads, but I guess mainly the moms are the ones saying this to me, but they're like, they don't know, they're watching them really closely to see what developmental milestones are hitting. And we're also trained to seeing that too, like, oh, is he not turning it? Is he not like turning when you talk? We check for their little baby reflexes, make sure they're curling and like sucking reflex. We make sure all those are functioning well and disappearing when they're supposed to disappear. That can be an early flag to say, okay, back to your pediatrician you go, because that reflex is hanging out a little bit too long. We check for tongue tie.
Are you allowed to diagnose tongue ties?
I normally refer back to pediatricians to get their final input, but it's I just recently did one. I'm like, I think he's 4 and he has a lip tie, and he's delayed speech. And I'm like, well, he does have a lip tie and no one's ever said anything to you about it. So there are little things that you catch like that where you're like, okay, well, that could have been resolved a lot earlier if someone said something. But
so if I, as a doula, notice some of the things you just said, am I in a position, I know you may not know the answer to this, but could I essentially say like, well, I suggest you go to a chiropractor to see if they can assist with A, B, and C, and maybe she can give you more information? Like, is that what you would recommend from my perspective?
Yeah, I think that'd be a good first, it's a good entry too. Because if a chiro can't help or I can't help it, it's an easy refer somewhere else. And that's the beauty of having like a birth team, like me being able to refer to you as a doula, and my pelvic floor therapist for like the mom, and like just having those outlets, because it's not like it's overlooked or underlooked for these small things, but to a mom that is a small thing, like, oh it's okay, he can still see that way, but like maybe in the future that develops into something bigger, and you don't, and or inhibits athletic performance. Or I know with my hyperlordosis, because I had maybe too much tummy time, that now I have to do a lot more work in flexion. I have to change the way I squat because I have too much curvature in my low back. And I wonder sometimes, like, is that because I had too much tummy time, or was I put in a bouncer too long? Or there's things that roll through my head where I'm like, well, that wasn't great for my spine. I wonder how that impacts me now. Because a lot of our rehab tools go back to cross crawl patterns. It's really interesting. So that how you cross crawl can turn into poor movement patterns as an adult. Yeah. And we are just scratching the surface on that.
That's so really interesting. Cool. Yeah. I know that you're close on your time limit, so I don't want to keep you. I have questions
for you if you don't mind.
No, I don't mind at all, as long as you don't mind a little bit of extra time.
Oh, no, that's a-okay with me. So I just wanted to ask you if you could tell people the difference of birth doula versus postpartum doula, because I always say it's important for both, but if you can only pick one, what would you pick? And tell us the difference.
Yeah, so for people that don't know, I am a postpartum doula. I have training in lactation education. I am a child passenger safety technician and a pediatric sleep consultant. I love being a postpartum doula. I mean, I love everything I do, but I am not a birth doula, and a lot of people get the two confused. And the difference is that a birth doula supports the parents before and during active birth. So like in the prenatal period, in the birth period, and immediately after in the postpartum period. But they assist with non-medical interventions, but they do a lot of physical interventions. They will help with adjustments, or some of the postpartum doulas are trained in spinning babies, and they assist and teach a lot of information that has to do with giving birth and what it is like before and after. And I come into play shortly after birth. So as a postpartum doula, I am non-clinical and non-medical support. And the same goes for a birth doula, but I'm on the other side. And I assist with basic breastfeeding support, more than the average person, but less than like a lactation consultant or an IBCLC. And I really like helping people to process their birth stories.
Yeah.
Because emotionally, you carry a lot from that. Even if it didn't seem traumatic at the time, it may have been, or
Absolutely.
maybe it wasn't. And if it's not traumatic, great. I'm glad that you experienced the birth of your dreams, essentially. I offer light housekeeping, so I'll do dishes and laundry. Like I don't care if I need to wash your underwear, it's fine. Like most of us wear underwear. Like I really don't care. And I cook healthy meals for people. I love cooking and I love helping people. So it makes me feel really good to be able to help these families. And I'll walk
so
in
important.
And, usually the first question I ask is, have you eaten today?
Yeah.
And do you have enough water? Because these parents aren't putting themselves first. They are taking care of these brand new humans, and they need to really think about what they're doing, because they're in survival mode for the 4th trimester, which is right after birth. And so my job is to baby the parent. Basically.
As they should be. I think our culture has totally shorthanded our mothers. Other cultures, like Mexican cultures, they do a 30-day lie-in. Like they don't move for 30 days.
Well, the same with the Chinese. I forget what it's called, but it's something really amazing.
Then they let all of their people make them every single meal, and they just drink bone broth, and it's like the most peaceful 30 days ever. And I love that. And I love there's people like you to help, because you don't think about who's going to do this, who's going to do laundry. You don't think about what is my mental state going to be to take care of this child and me. So it's super, super important. I always say if I had to pick, I would do postpartum doula, just because I know how much time and attention I would get delivering the baby from a vast amount of people. But it's really after it happens, who's there with you. So
I didn't answer that question. We hired a birth doula team, and I'm absolutely in love with them. They're amazing. And once Heather gives birth, I will share who she used, but I'm going to wait until then. But they're absolutely amazing. And we unfortunately are in a situation where we basically had to barter postpartum care with another. She's a lactation consultant. And she wants to be a birth doula. A postpartum doula. So we bartered care with her so that I am essentially going to mentor her.
Amazing.
In the postpartum piece. And she's going to come be our doula for a few hours.
I love it. That's awesome.
Yeah. And so what do I think is more important? TBD. I'll get back to you.
I love it.
I don't know.
You're going to have the most experience. I love it.
Yeah. I absolutely love our birth doula, though. She's phenomenal. She's a great advocate. She has so much advice. She's calm. She fits our personalities perfectly.
Yeah. I guess I'll ask one or two more. So your services start a couple days after around birth, and then when does it end? Do you support through the 4th try for a few months? How often do you check in?
So it really depends on the family and what they're looking for. But I have one family currently. They wanted me to start when their baby was 5 weeks, because that's around when we connected. And they were only going to continue for 2 to 3 weeks, and they just signed on for 3 more months. So, which is amazing, and I love it, and I love them. But so their baby will be around 4 months when I stop. And being a sleep consultant, I find it really beneficial, because I can kind of help the parents to get the kiddos and healthy sleep patterns to like, if you still need support at 4 months, I'm absolutely fine with that, but let's set you up with the tools for success.
Yeah. Yep.
So that in the future, you don't need support and you can do this alone.
It's all about when you're not there. Same with Chiro. What are you
Yeah.
doing when I'm not here? It's what gets it to ticket to success for sure.
Right. Yeah.
Yeah. My last question I'll ask today is, why did you become a doula?
So it's been a long time coming. I was married previously, and I used to say to my ex-wife, like, I really want to be a doula, but I don't know if I can. I wanted to be a birth doula, but I didn't want to be on call all the time.
Yeah.
And so that's one thing. I'm not on call as a postpartum doula. It's set hours. And birth doula, the hours are as needed, whenever the family needs you.
Mm-hmm.
So I used to tell my ex-wife that I really wanted to be a birth doula, and then I really wanted to be a postpartum doula, but I wasn't in a situation where I was incredibly supported. So I just kind of like pushed that dream down and did other things. And then a few years ago, when I met my wife, the whole tables changed, and hello, you're supported now.
Yeah.
And I think I did classes right before I met Heather, but then I ran with it, and now I literally can't imagine my life any other way. So
yeah. Oh, that's awesome.
And it's not just doula work, it's everything I do with the parent, the infant, the newborn, the child. I also do overnights right now for newborns, and I'm going to stop that when Sawyer's born. But right now, being there to support these parents so they can sleep.
Right. It's huge.
It's amazing. And I love cuddling these tiny new newborns who are these amazing tiny little people.
Yeah.
And it's a great job. I love what I do.
Oh, I love seeing your passion. It's awesome.
I'm very passionate about everything I do.
I love it. That's what the purpose of life is, I think, is to find what makes you feel that way. That's awesome.
Yeah. Well, thank you so much for chatting.
Thank you. This was so awesome. We'll have to do a part 2 soon.
Yes, we absolutely can. I feel like we can go on and on.
Yeah.
All right. Well, thank you so much.
You are so welcome.